during the new school year. Oh, thank you, David. We're welcoming everyone to our Navigating Neurofibromatosis Support for the New School Year webinar hosted by us at the NF clinics here at Mass General Hospital and Boston Children's Hospital. I'm really excited to have you guys here to share some of our tips for prepping for the new year, particularly thinking about learning at home and working with your pediatricians. And also excited to tell you about a study that we're doing here and then open it up for more discussion. So before I pass it over to our speakers, I just wanted to introduce the two of us who will be here on screen. So my name is Vanessa Merker. I'm the Director of Research at the Mass General Hospital Family Center for Neurofibromatosis and Schwannomatosis. I'm also an assistant professor at Harvard Medical School. I'm trained as a health services researcher, which means I'm really interested in understanding the ways our healthcare system works or doesn't work that well for people, as the case may be, and thinking of ways we can improve it to help people access care and get really high quality care, specifically for rare disorders like NF. I also focus on ways that we can learn directly from patients about their experiences through things like surveys and interviews. And I'm really happy to be joined today by Meredith Chambers, who is an education specialist and manager at the Boston Children's NF program. And I'll let her introduce a little bit more of her background, but she is like the tip-top expert in NF patient and family education and thinking through school supports and helping families with their learning and educational goals. And so we wanted to host a kind of back to school event. I know that for some of us who school is in September, this might feel a little early for back to school, but and we wish that summer was still going. But it is time to start thinking about back to school. And so we wanted to host this event to help kind of everybody prep for the new academic year. Thinking about, this is a great time for many of you to be scheduling your annual well child visit with pediatricians. We know some schools require that kids have physicals before they can participate in sports. They need proof of immunizations or a doctor's note to authorize the school nurse to administer medication. So a lot of reasons you might be wanting to check in with your pediatrician. We also know that if your kiddo is starting school and has something like an IEP or 504 plan where they're getting supports, that the beginning of the year is often a good time to check in with their new teacher and their new team. So kind of preparing for that. And as parents, caregivers, getting ready for this switch to the school year, the different routines, the new challenges and new experiences that might be happening in a school year. And we wanted to really be able to have a space to talk about that and to have you guys maybe even share your tips that you've learned along the way with each other. Um, and so with that, I'll frame up that we're gonna.
My name's Meredith Chambers. I'm the education specialist at
Oh,
Children's.
oh, sorry.
I don't know
I
why
don't know,
that
there
did
was
that.
audio somewhere.
I don't know. That was funny. Okay.
That was funny. Yeah, Meredith is actually here live. I don't know how I have a clip of her voice also taped over. It must be attached from there. I will actually introduce Meredith and pass it over. I'll actually maybe stop sharing my screen, Meredith, so you can share your slides
Okay.
directly. So we're going to start with Meredith, who's going to tackle
It's
how to
signing me.
support learning at school, and then we'll jump back to me and we can talk a little bit more about visiting your pediatrician.
Okay.
Oh, and I guess before one last thing is to just say that if you have questions, please feel free to put them in the chat when you think of them and we'll monitor it, but we'll try to save the questions for the end. We left the last 15 minutes of the webinar for discussion, so we'll definitely get to it then. So you can either put it in the chat as you think of it or save it until the end and we can share it with you.
Okay. Are you set? Are we ready?
Yes.
Okay. Hi, everybody. My name is Meredith Chambers. I'm the education specialist at Boston Children's Hospital. And my background is too many years, let's say 40, in education. And I've done all kinds of education. I've done special education for many, many years. I did elementary school, middle school, high school. I've taught at all the levels. And I've been at Children's heading into my 12th year now, supporting our kids with NF and their families on how to best advocate for their kids at school to get what they need between a 504 plan, an IEP, or whatever else types of supports that they might require at school, because it does come with a multitude oftentimes of different challenges, both academically and cognitively. And then for most parents, almost more importantly, socially, we often have challenges socially as well. So I do a lot of support with the families along with the medical team to try to do our best to help support kids with NF. So what I'm going to discuss today is support learning at home. I think school obviously does a pretty good job at supporting the kids at school, particularly in the beginnings of the school year. But we know as parents in particular, it can be quite frenetic when school starts, whether you have one child or a multitude of children. It can be daunting. So I just wanted to give you some tips that might be helpful for when the school year starts. It's not specific to any age or grade level. All of what I'll be discussing with you can be modified to elementary, not really preschool, but elementary all the way through high school. So let's get started with that. So creating a predictable routine is important. There are many variations of everything I'm telling you, so nothing is, written in stone or the only way to do something. But create a predictable routine is really helpful for kids. It's helpful for adults. It's helpful really for anyone. Human beings like predictability. Same with kids. So if possible, using a visual daily schedule, and that can be for homework. That can be for, breakfast, lunch, and dinner, cleaning the house, cleaning their bedroom, cleaning the kitchen, whatever it may be. Using daily schedules that are visual can be very helpful. And if you put a little check mark next to it, that's even more helpful. Keeping consistent routines is important. Doing things in the same place, the same time, particularly with homework, and we'll talk about that in a little bit, or schoolwork of any kind. Using transition language is important. So instead of, especially coming out of the summer where there's very few demands on the kids compared to coming now back home from school and there's lots of demands, instead of saying, go do your homework now, things like, how about 5 more minutes and then start the homework? How about, go get ready for bed and then you can sit and do your reading? Things like that. So it's more transitional and not so, jarring to the kids when it's time to finally do something. And predictability oftentimes helps to reduce anxiety and helps your child to build independence. And that's really your main goal, is to help your child to be as independent as possible. And it's really important to involve your child in creating the routine for buy-in. So, what works for them? What would help them feel better about, sitting down to start homework or start a project or start to read? Is it, you with them, or, maybe getting into more comfortable clothes or a different part of the house? Whatever it might make your child more comfortable would be helpful in getting some buy-in. And then setting up a dedicated space is super important. It's, again, part of the whole routine building. And you don't need, some people say, well, we don't have a big house. You don't need a big house. Just a little space is very helpful. It can be a corner of a room. It can be a small table. They don't need a huge, desk, like a teacher-sized desk. Just a little workspace that they can have that's kind of their own, that's quiet and clutter-free. And if you don't, I'll hop right down to the last one. If your home isn't quiet, many homes are not, you have animals, you have other kids, you've got people coming and going, use headphones or noise-canceling earbuds. Super helpful if you've got kind of a tighter space where the child is in amongst other people, to kind of reduce some of that noise. And have things already ready for them on that little space that they have, or big space, the pencils, the paper, markers, whatever they need, the computers, the calculators. So it's already there. So you're not hunting around every day looking for each of those things. Just have it kind of already set up and ready to go. And then include assistive tech if it's used at school. And by that, I mean, sometimes kids have their computers they're able to bring them home, or sometimes the computers at school are already set up with certain apps that are very helpful for your child in particular. If you can get either the computer to come home or ask the school if you can access the app that they're using, very helpful for the kids who have assistive tech of any kind, if you can access that at home as well. And help personalize a space to make it more inviting and comfortable for the kids. Let them decorate it or do what they want to do, that makes it more comfortable for them. And we already talked about the headphones and all of that. And then communicating regularly is super important. I think this is just really important for parents to do in particular, and for your kids to watch you do this. So every school does things differently. We don't know. I mean, every single district has different ways of communicating. Some use Class Dojo, some do Remind, some have Google Calendar, some use email, some want phone calls. Just ask and figure out the best way to communicate with your child's team. And in doing that, when you're working with your child at home, ask what skills to reinforce at home. So maybe at schools noticing that math is extra difficult for your child. Ask what you can do to help your child with the math. Maybe it's just breaking down the problem instead of 25 on a page, that they just do 5. Something very small can make such a big difference for your child. So communicate with the teacher to figure out what works best that way. And then also share successful strategies you use at home. So let's say maybe your child doesn't do well after 20 minutes of work, and they just start to decompensate and get all upset and don't want to do homework anymore. Share that with school and say, my child really only makes it through about 15, 20 minutes without and then needs a break. Could you please make sure they have a break at school too, around after that time? That really helps school kind of figure out what's going on with your child too. And that way you're communicating and combining what you're doing at school and home. And then keep that communication two-way. Your input is just as valuable as the teacher's input, and they want to hear from you. So what's working, what's not working, what can they help with, what can you help with? They would love to hear that. So be open to that too. And then follow up regularly to track progress. I don't mean weekly or daily. Some kids need that, but most kids don't. And it would be a lot for a teacher, especially if they are in middle school, high school, that have 100+ kids, to follow up with you, every day. That wouldn't be something that would be expected. But, if you're seeing some challenges and struggles, that's when you would follow up and say, what can I do to help? Can we meet? What's going on? All of those things. So stay in regular touch. It's helpful for you. It's helpful to keep your child on task, and also for the teachers. And then support the 504, the IEP at home. And some parents don't really think about that and leave that up to school, but it's really very helpful, because if your child is on an IEP or a 504 plan, that all the goals and or accommodations are all written out, and you can actually see exactly what the teachers are working on with your child. You can also work on those at home. So it doesn't just have to be only at school, and that may help your child move ahead a little bit more quickly as well. So review your child's goals and whatever, the academics, the speech, behavior, OT, PT, whatever. And if you can help them at home with those goals, then that would be excellent to try to do. And if you're not sure how to help, then ask the teacher for sure, or the special educator, how can we support these at home? And they'll be more than happy to let you know what's best to do at home and what's best to leave with school. And you can try something so simple like giving a 2-step direction. As we know, lots of kids with NF1 have challenges with executive functioning. So in with that oftentimes is following directions. So start with a 2-step direction at home, like go upstairs and brush your teeth. That's 2 steps right there. See if your child can follow that. And if they can do that, up it to 3 steps, whatever that may be, 4 steps, so that they get used to following directions. It helps with the listening skills, and that transfers back over to school as well. And then keep a brief log to track progress and share with the teachers. So That way they know what's working at home, what's not, what's working at school that might not be working at home, and how can you work together. And I don't mean this long, just little jots of important information that could be helpful to the teachers would be very helpful for you as well and for your child ultimately. And then use visual reminders or cues aligned with school strategies. So, maybe they have a schedule of the day. So, and it might be color coded. You may do the same thing, schedule of the evening, or what type of cueing words does school use that you could use as well. Very easy to find out from the teacher. Oftentimes, your child will let you know as well what type of cueing strategies they use at school. But there's always good ways you can get things like that helped. And then make learning something you can do all of the time at home. So for example, people are like, I wouldn't even know where to start. Something so easy as, cooking something simple or making something simple, like a peanut butter sandwich, something very basic and small, and then lead up to other things. So cooking can be very fun. Part of it can be going to the grocery store to get the different ingredients that you may need, have them go around the store and find them, and then maybe have them go and scan them and bag them, do whatever that would be helpful there. When you get home and start to cook, it teaches them about following a recipe, teaching them how to measure, how to, turn the stove on and off, following directions. Something so small that you do all of the time can be so helpful for your child, and it also increases their independence. And then something like playing board games. So simple it seems, but it helps really to hone many skills, helps them to build focus. You have to pay attention when you're playing a board game. It helps with the social skills, with turn taking, with good sportsmanship, with laughing and talking during a social time where it's not so back and forth with, only one-to-one person. It's sometimes easier for kids that have some social skills deficits to work around in kind of a bigger group like that. Something like that is so helpful, and it's something that the whole family can enjoy. And then I know a lot of kids, with NF can struggle to read, and that can come in many different ways. But one way that they all can understand is to listen to an audiobook. And it may be a simple audiobook. Maybe it's, on a level that's maybe a little bit less than they're used to. That's fine. You listen to it as a family, listen to it just you and your child. And that will help to support reading if they're really resistant to actually taking a book and reading that way. And then use things like outings, the grocery store, a park, all as teaching moments. It can make it much more fun for the child and also for you as well. You can always embed what's going on in school elsewhere. So I think that's a good way to kind of look at things where it's not so only school related. And then breaking tasks down, again, as I mentioned earlier, a lot of kids with NF really struggle with executive functioning, and we see it oftentimes in the lack of ability to break things into really small pieces so that they can feel successful. They tend to get overwhelmed really easily. And I'll give a quick example. Oftentimes, if a teacher will say, write a paragraph about what you did this weekend, their minds go and then, well, we went to the park and we went and got pizza. We watched a movie, and then they get all wound up and can't figure out, where do I even start? So breaking tasks down into small pieces is just helpful with virtually anything that you're doing. So small specific steps. So start with, if they're overwhelmed with, say, a math sheet that they have to do, just have them write their name first. Just put your name on it. Don't think about the 25 problems. Just write your name, and then say, let's do two examples or two problems, and then we'll keep the rest for afterwards. Maybe 5 minutes later, try the next two. Very small pieces. Do the work break cycle, and this could be anything for whatever you think may work for your family. 10 minutes of work, 5 minutes of a break. Older kids, 30 minutes of work, a 10-minute break, whatever it may be, but make sure there's some work and then a break. Adults need the same thing, so it's not uncommon for a child to have something like that too. And then praise the small successes to help build motivation. So checklists, if you check, actually it's been studied that if you make a checklist and then check it off when you actually finish something, it just automatically gives you more of those happy hormones and helps build motivation. So those small little praise of success, a checklist, your words, whatever it may be, will help your child as well. And then we talked about visual checklists before. It helps to show progress for them, very helpful. And then use consistent start and end cues like a timer or music instead of your voice saying, oh, 4 more minutes, 2 more minutes. Everyone has a phone, and there's all kinds of different timer sounds or music sounds you can add to that. Very easy, and it kind of takes you out of the equation. And then monitor for signs of frustration is so important. These kids go to school for a long day. And we know that lots of kids with NF also have focus challenges. They may have ADHD. It's just a hard day to get through for a lot of the kids. And that's okay. So definitely watch for signs of struggle or them being overwhelmed, and don't pile more onto them if it's not going to work. Nothing worse than trying to battle with your child to get something done. And that's why I say small, tiny chunks is so much better than just sit down and do your homework and just get it done. They don't often know how to break it down and just kind of decompensate. So oftentimes good to let them come home, have a snack, go out, play their sport, whatever they're doing, then come home and do that homework or project or whatever. And of course, adjusting the expectations when needed. Fridays are often a, easier day. Wednesdays are often heavy days. They're test days or test upcoming days. So just adjust the expectations. And always let school know what works or what doesn't. Schools are very good about working with kids and their homework or projects, and don't require them to do maybe as much as a child that can manage it all. So don't hesitate to talk to school about something like that. And take short breaks as always to prevent meltdowns. You don't want that. And always reflect with your child on what helped or what didn't. Your child's very good at being able to tell you, and usually has much more self-advocacy at home than they do at school. What worked? Why didn't this work? What was hard about it? Ask them, and then you can share that with school if need be. And always use school and whatever resources they may have. I just think it's really important for you as a family to not have to do all of the load. Ask school what available homework or learning tools do they have that maybe you could use at home or that your child can access at school. And identify go-to staff for questions. Sometimes it's the special educator. Sometimes it might be the social worker or the guidance counselor. Oftentimes it's the teacher. More often than not, it is. Use them. Ask questions. Ask for help. Ask for help for you. Ask for help for your child. And learn about whatever extended learning programs your community might have. The school social worker, the school adjustment counselor, school counselor, guidance would know about anything like that. If that's something you're interested in, definitely ask the school. And if you have a child that's on an IEP, absolutely ask the special educator for support. That's what they're there for. So don't hesitate to do that. And then your community also has lots of resources. They may have tutoring services. Your pediatrician may know about that. The school certainly would know about that. Don't hesitate to ask for your own help in helping your child. And then advocate effectively. This is something I like to work with families on too, is to teach them how to be their child's best advocate. It's hard. It's not something that's very intuitive, and every school and every team is different. So these are just very quick things to think about. When you're meeting with the team or the teacher, be clear and give specific examples about what struggles may be. I often have parents come to me and say, they just don't get math. They can't do it. Well, certainly a child can do something in math for sure. Be more specific. Is it that they're having trouble with 2-digit multiplication? Is it word problems? What is the exact problem that's going on today? Not what happened in the past, what's happening right now that they're really struggling with. And then you're able to give the teacher examples of that, and they can hone right in on how to help. Again, avoid the vague language that we often, it kind of gets overwhelming for parents. So it just goes into this big, like, they can't do it. And they often can. It just needs to be taught a little differently. And then ask questions to better understand whatever the issue is that school is seeing. So if you're not understanding what's happening, ask the teacher, can you tell me exactly what they're not getting at school so I can help them at home? That's absolutely okay. And they would want you to do that. And if you have several concerns, definitely write them down before meetings, because it's hard when you're in a meeting of 12 people and you're the only person that's not part of the school team. It's nerve-wracking. So write down your concerns ahead of time so that you've got them all right there and they can be addressed at the meeting. And then if you have samples at home that you think would be helpful for school, please bring them to school. They like to see what they are so that they can address them at school as well. Normalize asking for help. So important. If anything, advocate for your child and show your child how to advocate for themselves. It goes so far. It's one of the biggest keys that is helpful for your child at any age to start to self-advocate. And ask the teachers, counselors, principals, everybody's a resource, and let your child know that they are all resources. And pick a point person that might be helpful for your child so that your child would feel comfortable going to them. And of course, encourage open and respectful communication and teach your child how to ask for help. Instead of just sitting there and not doing anything, just say, raise your hand and the teacher will come over and then you can tell them. Or ask after class, or if you're too embarrassed to go before the class starts, or before school or after school, or go to the guidance counselor and let them know. Find somebody that your child can speak with that can help them get what they need at school. And remind them that seeking help is a strength, not a weakness. And there's that. You are your child's best advocate. I can do only so much. You're with your child every single day, so do your very best that way. And then I always say, try to close the history drawer. We always get these stories of the teacher last year was terrible or whatever, 4 years ago. It's a new beginning, a new year. We have to be positive. It's new for your child, new for you. There's going to be glitches. Everybody's human. But typically the school year goes pretty well. So enjoy the rest of your summer. We still have a good chunk of it left. And I'm sure I'll be hearing from some of you in the upcoming school year. Thank you.
Thank you so much, Meredith. And thank you. I see we have a couple of questions people have submitted already that relate to school, but we'll hold those to the end if folks don't mind. And I will go back to sharing my screen, because we also want to address, as we talk about school and thinking about school, some of what we can think about for also thinking about working with our pediatrician and our annual checkups. So we know that NF1 can predispose people to a really wide range of issues, and this can feel a little overwhelming because there's so many different things that might crop up across the lifespan, and they come across at different ages. And so this isn't to say that these issues here couldn't come up at later times, but as children are aging, we're always kind of looking out for new things that might be happening, and that could be from things that are pretty benign, like cafe au lait spots, those brown spots on the skin, which usually aren't too much of a problem, to things that we want to make sure we're catching early. This could be bony problems, so things that you might see early on, like problems with the long bones in the legs. Sometimes there are some kids who have neurofibromas, that's on the skin or internally, these plexiform neurofibromas. And we just want to make sure we're engaged with our pediatricians as well as NF specialists to have the whole team kind of on board looking out for these issues. And the good thing is pediatricians are very well equipped to look out and kind of be the first step at keeping an eye on many of these issues. I think some people, as much as we want people to see NF specialists, and we're so lucky to be here at Mass General Hospital and Boston Children's Hospital to take care of folks, we know that not everyone has access to these clinics, and even people who do might not see us as frequently as they see the pediatrician in their local town and community. And so we wanted to talk about kind of how you can work with your pediatrician to do some of the screening for these issues. And by screening, I mean kind of looking out for the new issues that happen versus treatment, which is when you already know something is there and you're following up, possibly with a specialist to get treatment for it. And so we actually are lucky in that we have guidance that's been published from the American Academy of Pediatrics, so the professional body of pediatricians that gives them some guidance about what to look out for NF1 patients. It definitely does recommend that people have some opportunity to go to specialized NF clinics for care coordination and to get some advice. And then it also helps tell pediatricians what screenings they should be doing to look out for new NF tumors and symptoms. And we wanted to go through just a couple of what those look like. As a caveat, this is not specific medical advice. Definitely, you should talk to your specific pediatrician about which specific screenings your child needs and what follow-up care. But we wanted to give you a taste of kind of what's in these guidelines and what are things your pediatrician can be on the lookout for. So one of the first things we can talk about is thinking of neurofibromatosis is neurofibromas. So pediatricians can help do some of these initial skin exams and neurological exams to look for these tumors, which is really helpful because if they are concerned, for example, maybe that there is a neurological deficit that they see, they can refer your child for imaging or follow up with a neurologist. And if it does turn out that they have a plexiform neurofibroma that's causing symptoms, refer them for treatment. We're really lucky to be in an age where we now have multiple approved FDA drugs for things like plexiform neurofibromas. So there's a lot of treatment options that are both already existing and coming through clinical trials that it's really a lot of options to keep open. So that's why finding some of these things as early as possible can be so helpful to make sure that they're caught and treated as early as needed. Although, of course, I wanted to say this is only if needed. Lots of people have smaller tumors or might have things that don't need treatment that are pretty slow growing and not causing symptoms. So I don't want to freak anyone out about finding these things. That's the kind of thing you can talk with your doctor, and your PCP can be kind of, oh, sorry, primary care provider, pediatrician can be the first line of defense to kind of see if more attention is warranted. There's also the kinds of screenings that you might be familiar with, and actually a bunch of your other if you have multiple kids, your other kiddos might be getting in their appointments. And they're things that pediatricians are very familiar with for all kids, but maybe are looking for something special in NF1, or it happens more in NF1. And so one example of this is scoliosis or curved spine. So kids with NF1 are more likely than kids without NF1 to develop scoliosis. And so having your pediatrician kind of know that that factor is happening and keeping an eye on it can be really helpful. And so this is something just as simple as a physical exam. So they might have your child kind of lean forward, bend over at the waist, and look at how their spine is shaped as a very first easy step at kind of screening for scoliosis. And then if there's some concern, they might escalate to getting imaging like an X-ray or other scans. And then ultimately, if they do find scoliosis, being able to treat that and catch that early as well. Your pediatrician would also be a really great resource for referring you to your other specialists that might need to be involved. So one example of this is in making sure you're getting your kiddos getting eye exams on a regular schedule. Particularly younger kids with NF1 are recommended to see an ophthalmologist, so specifically an eye doctor who has medical training. So not just an optometrist who might be screening for the usual issues of does your child need glasses, but someone who is actually looking kind of in the back of the eye and looking a little bit more comprehensively to see if your child might have any changes in vision that could be a sign of having an optic pathway glioma, which is a benign brain tumor in the visual pathway that can make vision changes. So again, this is an example of many of your kiddos might be going for eye exams, but something special to keep an eye on, something that might be more frequent with your kids with NF1 compared to other kids. So your pediatrician can tell you about kind of what schedule that is and help you keep on track. And then one of the last things I wanted to talk about, one of the other things they might be looking for are these signs of how your child is developing physically, cognitively, psychosocially. kind of closing this loop between educator and PCP and you as the parent. Definitely also, if you're thinking that your child is maybe a little late on developmental milestones or is having some trouble at school, sharing that with your pediatrician is really important so that they can also refer you for assessments and think about what kind of support systems might be helpful. If this is a physical delay, things like physical therapy or occupational therapy might be helpful and they can refer you to that. If it's something to do with, some kiddos might have social anxiety or other issues where talking to a psychologist would be helpful. Or neurocognitively thinking about school and thinking about starting that process and getting help for seeking an IEP and other neuropsychological testing. So really, your pediatrician is there to help with the whole person, not just these physical issues, also the mental and social things. So looping them in and making sure to check in can be a really helpful way to make sure your kiddo is getting the support that they need to thrive. And we wanted to share a little bit about some of the work we're doing to try and help pediatricians do this. While I said that we recommend that kids get the chance to come to a clinic like us at MGH or Boston Children's, we actually know that only about half of the kids who are signed up in the NF registry, or I should say half of the parents who've signed up their children to be in the online NF registry, have visited an NF clinic in the past year. And there's a lot of reasons for that. One of them is geography. This here is a map just of the pediatric NF1 clinics in the NF Clinic Network. So the clinic network sponsored by CTF, and you can see there's not a clinic everywhere. So that's just the travel can be one barrier, but other things like insurance or um, not knowing these clinics even exist yet have been barriers. And we found that specifically kids who don't go to NF clinics tend to get fewer of these screenings that we just talked about from their pediatricians, and might have to be doing a lot more self-advocacy with their pediatricians to get that care because they don't have maybe an NF specialist on their team. And so that's something that we are hoping to tackle here at MGH, thinking about how can we help you guys get the screenings that you need, especially knowing that maybe you can't always come to us for that guidance or for us to order the testing. And so we're really trying to see what the best ways are to teach people with NF1 and their local primary care doctors or pediatricians about these care recommendations. And we actually got this idea of kind of focusing on helping PCPs or primary care docs, pediatricians, from another program that actually already exists with folks who have Down syndrome. And so actually the team here at the Mass General Hospital Down Syndrome Clinic tested whether giving educational materials about Down syndrome to primary care doctors helped the kiddos with Down syndrome get the recommended care that they needed. And they actually found in a clinical trial that it was very successful. PCPs were happy to have this extra tool, have this extra information. The caregivers were really happy to learn a little bit more about what care their kiddo needed, and it led to more of these tests and evaluations happening. And so we're working to try to replicate that for NF1. And so we're working on creating different educational materials about the NF1 care guidelines I have here our patient and parent advisory board up top, our primary care physician advisory board here at the bottom, and some of the NF experts you guys might recognize here at the right, all coming together to say kind of what information would be helpful for you and your pediatrician to know about. And so right now we are running a clinical trial, so a research study to see what is the best way to educate folks about these guidelines. So that it's not all on you to do Google searching or try to find this out on yourself. And so we did want to let people know we are currently enrolling both adults and parents of children with NF1 who are here in the U.S. and who haven't gone to an NF clinic in the past 12 months to try these out before their PCP visit. So if you are scheduling your now annual, back to school visit with a primary care physician, please come check us out, and we'd be happy to help if you haven't been to an NFCN clinic. It's a really simple study. This is not something, we're not testing any drugs or any devices. It's just about actually these educational materials and figuring out which ones are the best. And so all you would have to do is do a survey online. We would give you one of the multiple versions of kind of educational material that we're testing. You would read it, you'd share it with your doctor, and then after the visit, you'd let us know how it went. And so pretty easy. There's up to $150 compensation if you're interested and eligible. If you are interested, and we'll send out these slides and links before you can contact us here at the clinic. I have the faces and names of everybody who works here, so you'll be able to put a face to a name if we reach out to you or you're talking with us on the phone. We'd love to hear from you. And even if you're not eligible, so if you do come to our clinics and aren't eligible at this phase of the study, we'd still love your help spreading the word. We really believe that kind of helping pediatricians and adult primary care providers learn about NF1 is important. And we've been actually a little bit slower to recruit parents than adults in specific. So if you guys as parents would be willing to share this with your network, we super appreciate it. We're really trying to enroll people across all 50 states is our goal. We want to kind of do things that are truly nationwide programs and really see what works across the US, not just here in Boston in our hometown. So you can see here the dark green is actually where we've signed up people so far, but the light green ones we're still looking for. So particularly if you knew any adults or kiddos there, please let us know. And I want to say, I know there are people on this call who do go to NF clinics and aren't eligible to join, but after this trial ends and we figure out what the best way is to educate pediatricians, whatever that way is, we're going to make it free, online, available for everyone. So temporarily, it's just being used in research while we figure out what's the best way to deploy this information. But as soon as we do, it'll be available to everyone, whether you go to an NF clinic or not. And with that, I kind of tried to just thank you for hearing about our research study and bring it back just before we open up for questions to how can you prepare for your back to school pediatrician visit. If you sign up for the MyNF Guide trial, you'll get some information, but even if you can't sign up for the trial or you don't have a visit coming up, there's other things you can do also to prepare in addition. Some things we wanted to highlight was just having, again, that list of questions about your child's NF1 related screenings, but also NF1, non-NF1 related care. This is a great time to check in about any concerns you have about sleep, screen time, maybe nutrition, how they're doing in school. And it's a lot, to balance both the NF1 specific things and anything else going on with your kiddo. So having that list, I think, written out and knowing which priority of things you want to address can be really helpful. We also wanted to remind folks to bring any forms with you from your child's school to your appointment with your pediatrician so they're there and ready to be filled out. This might be documentation you need for sports physicals, immunizations, permission forms from school nurses, anything like that to have ready and ready to go. And then the last thing is one thing to think about as we talked about this nexus of pediatricians, school, and what you're doing at home is that to think ahead if there's any medication you want to be kept at school. Maybe this is related to NF1, maybe something like pain medication or other things, but maybe it's not related to NF1, like an emergency inhaler or an EpiPen, and just letting your pediatrician know if you're going to need extra of that to be kept on school with the school nurse ahead of time. And I will leave it like that for there because I want to make sure we have so much time for your questions. Please feel free to either put them in the chat or if you want to just use the raise hand function, we can call on you and you're welcome to unmute yourself, whichever one that you're more comfortable with. And I know we actually have a few questions folks emailed us in advance. So maybe while I wait for folks to either chat or raise their hands, we could start with those. Evan, do you maybe want to ask some of the ones folks emailed us?
Yes, definitely. I can start with those. So the first question that we got is someone was wondering if we can touch on some important questions to ask in an IEP meeting.
You want me to take that?
Yes, please.
Okay. So I strongly encourage you to write down your questions before you even get to the meeting. Any of your questions or concerns would be the first thing to do because the meeting's really for you. And I feel like the teams are very good about letting you know where the challenges are, where the strengths are. So really, they often start a meeting asking what your concerns are. So that would be the first thing to do instead of asking the important questions. It's more what's on your mind, what are you concerned with, and what would you like to see done. They're very good about knowing exactly what they're going to do. And then your questions will come up naturally. There's not any one specific thing you should ask, but definitely bring your questions and concerns ahead of the meeting so you know exactly what you want to talk about.
Perfect. And another question that was asked was wondering how can we explain NF1 to teachers and educators who know nothing about it?
Good question. I always refer any team to the CTF, the Children's Tumor Foundation website that has the most accurate and beneficial information for school. There's actually, if you go onto the site itself, there is, I think it's called resources or library, something like that. It has handouts or information teachers can access right there on what it is. It's very quick read. It's very accurate. What NF is, how to best support, what type of supports kids typically need with this diagnosis. So that's a very good place to start.
Yes, and I will actually put a link in the chat and we can share it here of what I think is the brochure you were talking about,
Oh,
the guide
thank you.
for
There you
educators.
go. Yeah, that's
Yes.
great. And also getting a diagnosis letter from your either the pediatrician or the NF clinic that you go to can be very helpful for schools too. They usually give a little blurb about what it is and what schools might be seeing. So that would be helpful too. Thank you for doing that.
Of course.
Great. And kind of the final question that I have from the emails before. Um, Someone was wondering that they have a child who already has some difficulties, such as ADHD, and we're kind of wondering what the best ways were to set them up for a successful school year.
So if it's really specific to your own child. So if they're not already on an IEP or a 504 where they're already supported some way and you're starting to see difficulties, you certainly can ask that the special ed team do some testing on them, which would be academic testing, and then they call it psychosocial testing, cognitive testing. And that way they can determine whether your child is having some real difficulties, either academically or with the cognitive issues. And sometimes it's a social thing as well. So you can definitely ask to have testing done, and that will give you some good information. And if your child does have ADHD and you're willing to share that diagnosis, which I always encourage, but it's always up to you as a parent to do that or not, that's very helpful information for school to have. They'll know better how to support your child if they know ahead of time that that is one of the diagnoses that they have, or any other diagnoses that may impact school is always helpful for the school as well.
And I actually wonder, Meredith, a question I sometimes get when we talk about having testing, is that free to parents typically, or are there costs associated? I think maybe some people might not know about that.
So it's always free through your public school. So sometimes we have children that attend private school and the parents want testing done. You can get it done free through your public school, though. So it wouldn't be the school that you're attending. They may actually charge you for that, but public school testing is free. And even if your child is homeschooled or your child goes to a private school, you can access that free testing by getting it done through your local public school. That's a great question.
Oh, and I see also, thank you, Sharon Lofspring here, who is from NF Network Central Plains in Kansas, put also a link that their Kansas Parent Information Center puts out a lot of questions about asking for IEP, and they are willing to share it. So thank you so much for sharing that in the chat, Sharon. Does anyone else have any questions? I mean, feel free to go off unmute. If you can't raise your hand, you can, there's, I think, a small enough number of us that you're welcome to just go off on mute and ask it live. Or if you're more comfortable putting it in the chat, that's fine as well. I'm wondering, Meredith, as someone who has been working at a pediatric NF1 clinic for so long, um, is there anything that you think newly diagnosed families, if they're a little overwhelmed with where to start, I'm thinking at people who've just learned that they have NF1, is there anywhere you recommend they kind of start, or a good first place to go when things feel maybe a little overwhelming
It's a
with how
lot.
much
Yeah.
information we are giving?
So again, that CTF website is very helpful. A lot of people do the Google search, and it can be very alarming to do something like that. So I would strongly encourage doing that. And also, there's a lot of good support through NF Northeast, which is obviously covers the Northeast region. And there's get-togethers, there's information, there's things on their website that you can access. They're very helpful. So that would be so CTF first for like global information once you get the first diagnosis, because people are always like, whoa, what is happening? And then also NF Northeast, I think, is super helpful. And then once you're kind of into the groove of it and understand it and what's going on, you can reach out to school as well and ask for their help if you're finding your child is having some challenges. Not every child with NF has school challenges. I want you to know that more than half do, but that means almost half don't. So it's not a guaranteed, and it's not literally in every single subject every single time, or always social, or always cognitive. It can be a mix of it, or one piece of it, or no pieces. You might see it young, you might not. It just really is child dependent. But there's a lot of help out there, and I would encourage you to access it. And also your pediatrician and or the NF clinic is very helpful with information as well, giving you, support and what you might need that way.
Yeah, and I want to echo the same thing. I know it's can be a little overwhelming when we make some of these medical presentations about all of the tumors or symptoms or issues that we're looking out for NF1, but the only thing that is maybe very reassuring is I have never met a single person who has all of them. So it's a little overwhelming that you have to
Right.
look out for all of them. That does not mean your child is going to have all or even most of these things happen to them. So we want people to feel prepared, ready to act if they see things, keeping an eye on it without it becoming um, too much of a hopefully a worry or a burden on you guys. And I want to echo what Meredith said about the NF organizations. If anyone here doesn't know what their local NF organizations are, please let us know. Reach out, and we're happy to connect you. We have over 8 NF organizations, 8 or 9, who have been helping us recruit for our clinical trial. You might have seen some messaging from them. So they've been great resource in terms of if you're interested in research, if you're interested in meeting other families in your area to connect you with. Cannot recommend these groups enough for the amazing work they do. Let's see, I'll have one last call. If anyone has questions about school, about your next appointment, or any other things about NF1 we can answer before we head out. I want to give folks on the call a chance to speak if they'd like. All right. It seems like none here. If you guys think about it afterwards, I will be posting this. So we'll have the recording. We'll send the link out to everyone who registered. We're also going to post it on our YouTube page, which will have not only this webinar, but we also have some prior recorded webinars from our Mass General Hospital and Boston Children's Hospital joint annual educational symposium. So if you'd like to even look back at some of our past talks about current NF research and topics, you can even see more there. So thank you so much, you guys, for joining us in this still not the end of summer. We're going to still enjoy the rest of it, and then we will back to school soon. So thank you so much. We hope this was helpful. Please feel free to reach out to us if you have any other questions or would like any more information about what we discussed in the call. And I hope everybody has a great night. Thank you so
Thank
much.
you all.